Okay, it looks like we're good to go. Very good. Okay, so it is 6:04. I'd like to call the Amity Regional Board of Education special meeting to order. The first order of business is the Pledge of Allegiance. Do we have a screen share, Dr. Byers, or no for the flag?
Totally forgot about that. Sorry.
Not a problem. A lot going on. Okay, we will still do the Pledge of Allegiance.
Absolutely. We'll just have to pretend we see a flag.
Correct. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Justice for all.
So the first thing we're going to do is the section is comments from the Board of Education Chairperson, being me. We're going to move on to public comment after that. And then we're going to go into information on and discussion of COVID-19 metrics and instructional learning model updates. So I will start by saying good evening to everyone. I'd first of all like to thank the board members and the health professionals who are able to join this meeting tonight with such short notice. We really appreciate it. I know several of you requested that we meet in person for those willing to do so. I apologize we were unable to accommodate this request given the short notice. But we will certainly be meeting in person again for our next regularly scheduled meetings in accordance with guidance from our local health departments. This meeting was called for by 3 of our board members. Their concern is all of our concerns. How do we continue to provide an Amity quality education during these difficult times? These last 9 months have been difficult for all of us, for the parents working from home who do not have formal training in teaching, attempting to help our kids with new technology while still doing their normal jobs. For the parents who are essential employees, as well as our teachers and staff, who interact with the public on a daily basis, trying our best to be safe and not bring the virus home to our families. And lastly, for our students, many of whom hold a sense of loss of their sports and clubs, loss of seeing their friends, and loss of learning in an environment the way it used to be. As recently as Wednesday, the director of the CDC reiterated his advocacy for in-person learning, citing evidence that schools are not a major source of coronavirus transmission. The director stated, "We now have substantial data that shows that schools' face-to-face learning can be conducted in K through 12, and particularly in the elementary and middle schools in a safe and responsible way." Governor Lamont and the Connecticut Department of Education fully support in-person learning in our schools, as long as the local health departments concur. The American Academy of Pediatrics statement on COVID advocates strongly that students be physically present in schools by stating, "The importance of in-person learning is well documented, and there is already evidence of the negative impacts on children because of school closures in the spring of 2020. Lengthy time away from school and associated interruption of supportive services often results in social isolation, making it difficult for schools to identify and address important learning deficits, as well as child and adolescent physical or sexual abuse, substance abuse, depression, and suicidal ideation." There are a lot of questions many of us have, and this is why we will be hearing from our health district advisor and our 2 health districts in a few minutes. If there has been one constant over the last 9 months, it's been that Amity has worked in partnership with our 2 health districts. School districts' consultation with their local health departments is exactly what the state is recommending districts do, and Amity is no exception. The health districts have advised us from what our PPE of our staff should be using, to setups of spaces in the schools, to training for our nursing staff, and when Amity should be in person, hybrid, or remote. Regarding remote learning, Amity has always offered a remote option for our students, and of course will continue to do so. For the first couple of months, when the numbers supported full in-person instruction, as per the leading and secondary indicators outlined by the state, the health departments recommended hybrid instruction. Some saw this as too conservative an approach. This past Friday, the health departments recommended we go hybrid in the high school and in-person in the middle school. Some see this as not conservative enough. One thing is for certain, the health departments are the trained professionals in community healthcare, and we will continue to follow their recommendations as we have all school year. With that being said, I'd like to move on to public comment. For public comment, we had quite a few emails sent to us over the last few days. I believe it was 155 public comments. So unfortunately, in the essence of time and with our guests as part of the meeting, we decided we are not going to read everyone or comment on everyone, but we will share what the crux was as far as what they were writing about. All of these public comments have been shared with the Board of Education members, and they will be included in the meeting minutes packet and posted on the website. So we had 25 letters in support of continuing the hybrid model. Some of these specifically supported the hybrid model at the high school, some for continuing the hybrid model at both the high and the middle school. We had 51 letters supporting remote learning. Many of these advocated remote learning through the winter holiday break. We have 43 letters supporting full in-person learning. Some of these supported in-person learning in general. Some support in-person learning at the middle school and advocate for in-person learning at both the middle and high school. We had 12 letters specifically supporting a hybrid model at the high school and full in-person at the middle school. And we had 16 letters speaking against a particular model of learning. 11 spoke against returning to in-person learning, and 6 spoke against remote learning. There were an additional 8 letters that addressed either multiple issues or different issues, such as support of a teacher or concerns for student mental health. Okay, again, those will all be posted to the website for anyone to access after the meeting. Okay, moving on. Dr. Byers, would you like to introduce our next topic, which is information on and discussion of COVID-19 metrics and instructional learning model updates?
Yes, absolutely. And I sort of want to begin with, I think the letters that were received for public comment tonight is kind of, it summarizes in a 24-hour period what school administrators and leaders have been experiencing basically since somewhat last March, but definitely since I'd say August of this year. And that is that we have a diverse community with lots of different individuals in it, all of whom come with different backgrounds, different perspectives, and different opinions. And it's really because there are so many different people who are weighing in on this that we have been turning to our public health experts and to our school medical advisor throughout this period. Because when you hear all of those voices, ultimately, in the end, you're going to turn to some experts who are going to provide you with the advice for making decisions and moving forward. And I would, again, certainly say that we have relied extremely heavily and with a great deal of success on the Orange Health Department, on the Quinnipiac Valley Health District, and on our school medical advisor, Dr. Germain. At the start of the school year, when the metrics for COVID truly supported full in-person learning, we listened to the advice of the health departments, and we opened in a hybrid model to make sure that we had everything in place the way that we wanted to have it so we could welcome students back full in person. In mid-October, when the metrics still supported in-person learning, and we were looking at switching over from first quarter to second quarter, we talked to the health districts, and at that time, they did not advise that we go to in-person learning. And again, perhaps not in the decision that I wanted to hear, we heeded their advice and we remained in the hybrid model. And certainly on November 10th, when we received a directive from the State Department of Education to not make any planned remote periods following holiday breaks, We listened to our health departments and purposely planned for a period of remote learning after the Thanksgiving holiday break. They were there on November 13th at 7 o'clock p.m. when I had to pull a quick strategy meeting and make the very difficult decision to put the high school into remote learning because of a high number of cases that we were seeing in our high school population, although those were not occurring in the school. And so I guess I'm just reminding the board that throughout this entire process, they have been a partner. They have been a collaborative decision maker. And I think we've been successful because we have listened to their advice and their expertise. And I think that that is something that I continue to do, whether it's every week as part of our planned meeting or more frequently when I basically text Dr. Muhammad and Ms. Walujewicz essentially every single day with some sort of question, concern, issue, or clarification that's needed. I'm certainly going to turn the meeting over to them, but I did just want to make sure that I had an opportunity to share the most recent data that we have today in terms of what the COVID cases look like in our community, as well as some additional data that we have just been able to start to pull together. So I am going to share this screen. So our current COVID data, you can see I had sent this to the board yesterday. We did have a slight change, one additional case that was reported at the high school, one additional case that was reported at AMSO, and a few more quarantined. I will say the thing I'm seeing different in the quarantining patterns is we are having families report that they are quarantining as a result of travel, presumably over the holiday break. So I do appreciate those families who are following that guidance and who are keeping their students at home, but who are also calling in to report that. But again, you can see that since yesterday, we've had a small change in numbers. And of course, pretty much every day we have some come on and then also some come off. But that is where our current COVID data is as of December 8th. The second piece of information that I would like to share are the number. So we just finished looking at our data on quarter 1. And so we went back for the past 4 years and looked at the number of Fs that our students received from 17, 18 through this year. And what we are seeing, and I think the data speaks to itself, is almost a tripling of the number of students who are not being successful in our academic programs and classes. And so I know that in many cases we are receiving communication that indicates that the hybrid model is working, that remote learning is working, and I would agree it is certainly working for some students, but I think we also have evidence, increasing evidence, that it is not working for all students, and it is significantly not working for many of our students. I spoke with Ms. Mann this morning. As of today, she has had 15 meetings with students because they are in jeopardy of not graduating. That is a 50% increase over last year, when at this time she had 10 meetings of students who may not graduate. And that is also a significant concern because graduation is part of their future success in life. So I'm just presenting that data because we did not have solid academic data to share with the board up until the close of the first quarter. And now we have some information that perhaps helps us understand some of the impacts that the hybrid and remote learning is having on our students. The other thing I would like to share with the board, again, just for informational purposes, are the number of opt-outs that we have. This again was as of today. So you can see what the total enrollment is for each of our 3 schools, and then the number of students who are in the voluntary opt-out. And that sort of gives you the percent of students who are opting out, or you can inverse it and it would help you understand the percent of students who would actually be attending in person. Obviously, at the high school, we're looking about 3/4 of our students would be attending in person, but because they're in the hybrid, it's really only half of 3/4 each day. In terms of the middle schools, we're looking about 75 to 80% attendance when we are talking about a full capacity. And then in all of those cases, you can generally, and this has just always been true, you can usually factor out another 3 to 5% of just typical kids who are absent. I'd probably say we have more of those because our parents are being cautious, and if somebody's sick, they are not sending them into school. So that actually further reduces the percentage of students who are physically in the building at a given time. This has gone up a little bit since we returned from the Thanksgiving break, but we were actually monitoring the attendance up until the time that the high school went into its remote learning model, and it hasn't changed that drastically, although we have certainly seen an increase in some of the requests for the opt-outs. So I just wanted to share that data before I turned over the discussion to the health districts about the current status of the COVID data, and then also some of the decision making that has gone into making the recommendations for the learning models going forward. So we have 3 people here with us this evening. I think you've all met them before, but actually 4 people here with us this evening. So we have Dr. Mohammed from the Orange Health Department. We also have Mr. Sligowski from the Orange Health Department. We have Karen Walujewicz with us from the Quinnipiac Valley Health District, and then Dr. Germain, who is our school medical advisor. And so I will turn it over to them for a conversation of current COVID metrics and then learning models.
Good evening. Thank you, Dr. Byers, for inviting us. This is important to have consistent message. Karen or Dr. Germain, would you like to start first?
Sure, I can go right ahead. So I'm Karen Walujewicz. I'm the Director of Health at Quinnipiac Valley Health District. And just as Dr. Byers has mentioned, we've been in direct collaboration and communication with Amity Public School District from the very beginning, from reopening of schools, as well as continuing to monitor the current COVID-19 data on the data portal with Connecticut, and as to advise on the different learning models based on the current data on the prevalence and the community spread of COVID-19 within your school community and in the greater community at large. So as you know, Addendum 4 is sort of our playbook for providing local district guidance and decision-making from deciding the different learning models. So Addendum 4 is based on the primary indicators, the number of new cases, and then secondary indicators. So we look at this data to determine what is the level of risk for COVID-19 transmission in schools in the greater community at large. And then looking at that data, we determine what is the implementation of the mitigation strategies that are being employed within each of the schools. So you have to balance the risk with the ability to maintain the mitigation strategies in place to ensure the health and safety of the students, staff, and the support staff within the school community. So based on our observation, we did an on-site visit at the middle school and high school during reopening, and then when school was in session, and we were able to see the mitigation strategies that were being employed that are recommended in reducing the risk of transmission of COVID in the school settings. So social distancing, mask wearing, hand hygiene, and all the other mitigation strategies in place that the CDC and the State Department of Health recommend. So again, we look at the data, and that helps inform and guide us to make the best decision on the current data that is available. We know that it is an evolving situation, so the guidance can change as well as the metrics can change. So we have to be flexible, and this is new, unprecedented times. So we are trying to make the best decision for obviously the students, for the education, their health and well-being, as well as ensuring the health and safety within the greater community and reducing the spread of transmission within the school settings. As Dr. Byers mentioned, the State Health Department and CDC have not indicated that schools are a source of spread of COVID-19, and it could be linked to other community sources of transmission. But there is no reported information on in-school transmission related to cases and contacts. So if Dr. Mohammed would like to speak.
Thank you, Karen, for summarizing our strategies, how collaborative effort has been since the beginning of the school with site visits and modifying some of the communication from the school towards the health department, in terms of contact tracing. It has been evolved and has been, improved significantly since we started, because we all have been learning every day and modifying our approach to do the best as we can and providing the safe learning environment for our students. So as Karen mentioned that, CDC has looked into it, and they have revised some of the guidelines for contact tracing, looking at other factors. I think Department of Public Health in Connecticut will be looking at their previous metrics and may revise some of the other indicators. So I urge everybody to kind of look into this situation as ever-changing, evolving, and we have to be flexible. From the community aspect, when we do the contact tracing and we talk to these parents and families, we have found two significant factors that was summarized in Dr. Byers' letter that was sent out. First one was the outside activity, play, sports that has now been put on hold until mid-January. So we got this window of great opportunity to see what we can offer in our school system, because that has been by far the significant source of infection among students, school age students. The second factor that contributed to our decision making was, how do we have more data now in terms of where we are, in terms of transmission rate and the community-wide transmission versus where we were at the beginning of the school. So I have always advocated for reducing the density, and that was the reason why the health department did not approve the model back then, because we weren't sure completely how things will change. And we all have appreciated now that those decisions have actually helped us in mitigating the community-wide transmission, knowingly some of the challenges, with Thanksgiving and other community events that may have happened, in November. We also had elections and polling and all. There are many factors. We have found that almost all the other cases that were transmitted among kids were from their parents or the elderly person in their household. I had been in close conversation with the school district, notifying them that there's always a significant percentage of transmission rate in the same household, almost 60-70%, that if one person is affected, the other household members do get affected. And that's what we have seen in the 1 week of remote learning, 100% remote learning, that cases turning positive. So still, it's not to that rate where we would say that in-person learning is impossible. However, it doesn't mean that we will let our guards go and not continue to monitor. The point is that we have all the opportunities to look at how it will pan out, and then we will continue to strengthen the mitigation strategies in all these schools. Elementary school system have done well, and over the course of months, we have evolved as needed. So while we cannot say that middle schools do necessarily or exactly the same as elementary school, but the model is very close in terms of learning between middle school and the elementary school. However, high school is totally a different entity when it comes to learning and cohort and other challenges that we already knew from the beginning. So I think those were the points that were taken into consideration. And again, as Karen said, this is a very fluid situation. We have to be flexible. We have to ensure that we adapt as we go forward. We cannot fully or completely say that the pandemic is over until we have 70% of the population either vaccinated or have some level of immunity. So there's a lot that needs to be done over the course of years. But as a parent myself, as an educator myself, I think it's a very challenging time to keep the students. And obviously, what Dr. Byers has noted, it's kind of, you have to weigh the risks and benefits. And if we can provide the safe, in which I believe that, school has done absolutely a great job, and they will continue to modify some of the other aspects to provide the safest environment for our students. So I'll stop here. Dr. Germain, do you want to please add a few things? Thank you.
Thanks, Dr. Mohammed, and thank you, Mr. Belfanti and Dr. Byers for including me in this discussion. This is incredibly important. I just want to remind us all that a year ago we didn't know what the term social distancing was. We didn't know about masking. How far we have come and evolved in a very short period of time is amazing, and I think the success and safety of the Amity School District has to do directly with the role that the faculty has taken, our trusted health advisors, and under Dr. Byers' guidance. And what we've learned in last spring and over the fall with the heavy lift of all the changes that were made within the Amity District this summer is that school is a relatively safe place. So as Dr. Mohammed spoke to, we are not seeing outbreaks happen within the school system. And I think as of this week, there have been no major outbreaks centered in a public school district in the entire state of Connecticut. And this speaks to the incredible work that's been done. We know that in-person learning is better. And as Dr. Byers has pointed out with her data, and it's been in the national news recently, we know that students do better in person. We know we have lost a lot in the city of New Haven as that public school system has sent their students to school 0 days this school year, and a third of the students in the New Haven Public School District have been totally lost this school year. And we know educationally it's better, but also developmentally. So the American Academy of Pediatrics has spoken strongly about how important it is for kids during this vulnerable time to socialize, to engage, to be in class learning and developing. It's a critical time. So we need to balance that need for child development and education with something reasonable as far as safety measures to make sure that we're not putting our kids, our faculty, and the parents and grandparents and families at risk. And I think over the course of this fall especially, that balance has been struck nicely. And I agree with what has been said previously that the pandemic is a national crisis, but it's a local issue, and we have to look locally at our numbers, look locally at our spread rate, our infection rate, and make decisions on in a fluid way. And I think my advice is that this has been done, and we will continue to look at the numbers hard and take care of our students and our faculty.
I know that our health districts have received questions, I believe, from parents and from some teachers. And so I'm thinking that you have had a similar series of questions from people basically since last Friday. So I'm wondering if you could maybe summarize some of the key points that you probably have to keep repeating over and over, so that perhaps the board is able to hear some of the things that you have been asked and then how you have addressed them. I think most common is sort of, why are we going back when the town data doesn't look the way that it did back in early fall, and then just oftentimes questions about sort of the safety for our students and for our staff.
Yeah, I'll touch upon it, and then Karen can add further. So the basic questions like why schools are not considered, why are we going back in person, and when the data is trending the other way, and we had anticipated. Now we're in the middle of pandemic. It was just a matter of time when we see numbers turning up. So now that state is also including some rapid testing being done. And again, we have had issues with the rapid testing. Now they're including the denominator. So obviously we're not going to see anything sooner. But if you reflect that with the school going children, we are not seeing that significant of a rise as we are seeing among the older population. So that has been the first question. And again, when you do the contact tracing and you ask about the factors, we have found these situations where, again, older person in the household is the person who's infecting, and 60% of the time the transmission gets infected to other household members. So that's sort of a common theme or common trend. When kids are in the structured environment like school or any other, still much lower chances of cross. We have not seen any teacher becoming infected from the student or student from the other students. So those have, again, we have 3 months of data, almost going into 4 months, kind of give us a little bit of confidence to how things are trending. The mitigation strategies, all 5 of it, as Karen summarized, do need to be strengthened at various angles. Some of the gaps or some of the areas of improvement can still be done. I wanted to make, earlier we had a meeting with the teachers of our middle school. I tried to address some of their concerns again, why teachers should also be feeling comfortable, and if they think they don't have enough or adequate PPE, they should reach out to the school and to us so we can help them get any type of personal protective equipments that they feel more comfortable. So there are many options that are available, but I think when I hear in general news that schools are not safe, I just feel that it's not a true depiction of where we are. We are not out of pandemic. I don't want to give anybody false assurance that we're not going to see any cases. We will, but we have also seen that those parents and families who have did due diligence have done extremely well in terms of limiting and keeping themselves in their bubble, and it's a sacrifice that requires from all of us. All of you are sitting here and looking at the current ongoing situation. If we had received one single unified message, then we would not have seen rising in Midwest, different areas. So if you look at overall state of Connecticut, it's still 6.5 or 6.6, which is much better as compared to Midwestern countries where the rate, the overall state rate is like in 20s and 30s, thankfully. So we started off quite strongly. When the governor transitioned into 3, we were not all in agreement. Local health directors, we were very upset when it took so long for all the leagues to be put on halt, so to speak, because there were no guidelines being followed. There's still some challenges. I'm sure there must be happening. These private, again, those who are following the guidelines have done it well safely. I know how sport is important, and Brian can share some of his experiences when he's talking to the family, when I'm talking to the family. So I think what I want to emphasize is really that we all have to be in this together. School, parents and families, and the health department. We cannot just ignore any factor of it. And if someone noticed anything deviation from normalcy, which is, again, a difficult word during this time of normalcy, but we try to emulate as much as possible. And again, the outcome is students' well-being, their future success and development. We cannot ignore that as well. And yes, I was talking to Dr. Byers over the weekend that I had discussion with my own family, like how once things are going and every, the entire map of Connecticut looks red, it is now, in-person learning will be possible. But I still feel that I have confidence in our system that what we have put in place will be there, and we will continue to augment that. If we find any variation from the best practice, we will enforce that. We will put that into place to prioritize the safety and well-being of our teachers, staff members, as well as our students. So I just wanted to assure everybody that we're not, ignorant of any factors that they may have thought. But when it comes to say, well, schools are not safe, what are we comparing with? We have seen, data published that most common factors for, transmission of infection have been in-person dining, some of the other bars which already are not open in our community, and some other gatherings, as well as some of the religious buildings. So those are the structured areas where things are not being practiced in a way that we would like to. However, under supervision of our professional teachers who are well trained, and obviously, and I think kids have done remarkably well. I must say that when I go and do the random visit, I find them everybody wearing masks, keeping, they do need constant reminder. But I think one demographic of population in again, my experience as a public health and a clinician are among the children. They have been very much compliant. I think Dr. Germain can add to it as a pediatrician. Peds population have done incredibly well in following the guidelines and following the instructions. It's the older segment of population that has, unfortunately, and again, I'm not pointing fingers at anybody, because kids are a reflection. They follow, they follow you. They consider us as a role model. So I think compliance has become the issue as well, which we have seen a higher compliance rate at the school level. So all these factors give me, as a public health professional, confidence that yes, we can continue to provide safety. If, however, God forbid, we do see some negative trend, then we have to pull back. It's not written in stone. We have to modify. I have asked all the principals and superintendent to be, considerate about that. When we reach out to you and provide you advisement, that's coming back from our experience in the community and backed up by the data. So that's the collaboration that has really helped us in preventing any type of outbreak in our community. And we would like to continue to do the same, robust communication, timely advisement. So school leadership has all what they need from us, so that we can make joint decisions for the best of our community. So it's going to be ongoing effort, as I said. And there's never, other questions that Dr. Byers was like, why now? Why can't we wait after the holidays and all that? Well, I don't see very strongly that we cannot do it right now and we must wait. So there's nothing that it's up to, if the schools were not prepared or equipped with all the PPEs and other, we may have waited another week or two to ensure that we have all the supplies and metrics. I don't think that's the reason to hold back, right? So those are the common themes that kind of emerge as far as I remember. I'm sure I've spoken to many, and I may be forgetting a few points, but that's what I can think of at this moment. Karen, would you like to add a few things if the questions that you had received, they were different than mine?
Sure. So I think the main question is regarding the matrix, again, with the school starting off in a hybrid mode, and then transitioning now, when the percent positivity was a lot lower than what it is currently now. Why now are we moving into full in-person? So again, we have to review the data. We've learned a lot from how schools are handling the transmission of COVID-19 in the community and within their school setting. And we've learned that schools are very successful in their mitigation strategies. So based on the CDC learning model, we know that even though there is a moderate risk based on that CDC matrix, a moderate risk for transmission of COVID, and there's a high risk within the community, this is lowered, the risk is actually lowered in the school setting, because again, you have that multitude of mitigation strategies that are employed in the school setting that can help lower that risk of introducing COVID-19 into the school setting, as well as allowing for transmission of the virus. And the other question is, again, if there is a lack of a mitigation strategy, for instance, social distancing, if students and or staff are unable to socially distance based on the classroom layout, how can you ensure that it's a safe environment? Again, you can't just look at one mitigation strategy. You will have to look at all of them as a whole, and all of them as a whole is helping to reduce the risk of transmission.
So I would say that out of respect for time for our guests that we have here this evening, and Mr. Belfanti, if you think it's appropriate, we can probably open it up to questions so that we can address any concerns or thoughts from the board members while we still have Dr. Germain and Dr. Mohammed, Mr. Saliavsky, and Ms. Wulujewicz on with us. Is that all right?
I think that's a great idea. Thank you.
All right, so I saw Ms. McCrevin raise her virtual hand first, so I will allow her to speak first.
Okay, thank you so much. I want to just start by saying thank you to everyone who is able to be at this meeting and to give us information. I think it's so important that we're letting the community hear us. I know we have a lot of people watching us on YouTube right now. So thank you. My hand kind of shot up virtually there when I heard about negative trends. So I wondered, just to kind of ask that question of our health advisors, is there a negative trend? I know that Addendum 4 says look at our county data. Lots of folks have written in to say to us, look, I'm looking at the county data. This is what I'm seeing. What does it mean? Can you speak to what negative trend the community should be aware of? What negative trend would cause changes to your suggestions for us?
Well, I think the trend in terms of case positivity, or in terms of how many cases are we getting per week, if we see a negative trend, by that I mean, we have seen in November much more cases than we witnessed back in spring when the pandemic started, right? It's kind of slowly escalated. Now, as I said, initially, the state was not including rapid antigen testing in their reporting or denominator. So we were expecting that the number of cases will eventually be higher when those data will become will be included in that. So by that I mean that we will see on a weekly basis. So for example, in this week, if we had 5 cases, this is a negative trend towards 20 cases that we received a week earlier or so. So that type of things are going to reassure that yes, even the community-wide spread is kind of plateauing. Again, we can't say for sure because we're still in pandemic. Those risk factors may change, but reinforcing the elements of preventive measures among family, among businesses, and all that factors would play a role, because we all live in a community that's interlinked among us. So your neighbor, and me, if we both are neighbors, it's all dependent on both of us, right? So it takes everybody. So that's the trend that we want to make sure that it's going in the right direction. It's not the other way around. If you're noticing, on the other hand, more cases coming in, in this current model of learning or after the holiday, then obviously we have to be more conservative and more restrictive. So that's the trend that we have to monitor very frequently. And both Karen and I are on bi-weekly call with the State Department of Public Health. We calculate our own cases. We don't wait until the state provides the infectivity rate. We know on a daily basis what the trends look like. So I hope that answers your question.
So could you just speak to the county versus the towns, though? Because I think that obviously we know that you're looking at the Woodbridge, Bethany, Orange towns, but the New Haven County data is obviously quite bad. Addendum 4 says that we should be looking at the county data. How do you balance that?
I think in my opinion, we certainly need to look at what's happening at the town level individually, because that will give us a better reflection of what's happening in the community. I think it's for the reporting. It used to be only county level data were provided, but now you can go on CD website and then you can see, in fact, each city or town level data is also provided, which is more granular, which is more accurate to say that. But again, we cannot differentiate, or at least public will not be able to differentiate what type of testing was done, what were the settings, and that happens in the contact tracing when we speak to people. Some are very contagious, or some are very symptomatic, and some are not, and there are many other factors that play a role. But I'm a big fan of, and actually, when only county level data were being provided before, I believe it was up until October or maybe mid-November, they were not showing us the town level data. And I was asking almost in every meeting that when will that data be available? And I was promised that yes, we will be posting that data sooner than later. So eventually it became. So I'm a big proponent of looking at the individual data, because I mean, what's happening in New Haven, more density, much more, different demographics in the school system. I won't have any say on it, how to mitigate or how to control, but I can look at my town and look at the several factors. We actually have been working with our police department, and we do have a GIS mapping to see exactly where cases are popping up. So in this way, we can look if the trend, as I said earlier, is kind of going in the wrong direction in one specific area in the town to address, and what are the situations. So again, that's for my individual level of satisfaction to see or be available to that community what's happening, and intervene before it's too late.
And I think Dr. Muhammad brings up a big point, a good point from our Friday morning meetings, because we have those and we look at the data that's published on the state website that's available publicly. And then both he and Ms. Woluchowicz actually bring the knowledge that they have as public health officials and kind of add to that. So rather than making the decision with just sort of 4 sets of data, we're able to actually look at things in a little more detail. I remember, a few weeks ago, Dr. Muhammad coming and trying. Part of the reason why we didn't reopen full in person back in October is because we didn't have any of the rapid antigen testing as part of the data sets. There was absolutely nothing there. And so, he kept talking about, well, it's, we have to consider this information as well. So we meet for about, 30 to 45 minutes, and we have a conversation about far more than what you see on the state website. Or frankly, I send you all kind of like, I try to send a sort of little weekly snapshot if you don't have time to go look for that. And so it's much more in depth than what we kind of encapsulate in the couple of graphs that are related to Addendum 4. And I think that's been part of our learning curve as well since the reopening, is that we have some data available to us that I don't know that the state actually anticipated we would have as part of these conversations.
That's great. Thank you very much. I'm going to ask one other quick question, and then I don't want to take up all the time. Mitigation strategies. We talked especially about how elementary school, middle school, and high school are very different in how much you can mitigate. The big one, of course, at the middle school is the cohorting. So I wonder if there's anything about cohorting we need to be especially mindful of as rates go up in the community. If like 2 classes per day are not in cohorts because they're art class or whatever it is, when do we start to lose the benefit of the cohort to the point that we have to be more careful, that we have to have other mitigation?
So I'll take that on. So cohorting obviously is best when you limit the number of people to a small number group consistently as best you can, and limit the interaction between the different cohorts. I feel like I'm going to sound like a broken record, but cohorting is just one of your mitigation strategies within your suite, within a tool, within your toolbox. It's just one of many. So if one cohorting, your mitigation strategy, if you're unable to ideally keep within the cohorts, say for whatever reason, staffing, then you have your other mitigation strategies that you are going to ensure that are implemented. So that's mask wearing, social distancing, hand hygiene, ventilation system, which Amity Public Schools, I know, are implementing all those mitigation strategies. So again, you have to think of it as an entire suite of your strategies versus just one solely that's going to increase the risk of transmission. And obviously, if cohorting, you bring in intermixing of students and or staff, is going to increase the level of exposure to one another. So if there does happen to be a positive case within that cohort and there is intermixing, then yes, that would, depending on if they meet the close contact definition by CDC, that would increase the number of individuals that you would probably need to recommend quarantine for if they were determined to be a close contact. So that would increase the number of individuals that we'd recommend for quarantine. So if that does increase the number of individuals that we recommend for quarantine, then perhaps that you need to make an assessment and try to, again, limit some of that interaction and keep students and staff within their cohort.
Thank you.
Does anyone else have some questions? I knew, Dr. Turner, you were going to raise that hand.
I'm good at questions. I tend to get easily confused. Dr. Muhammad, you were talking about how you came to feel that the school setting was safe. And I thought that I understood you saying that reductions in density were a big part of that. So if you can just walk me through, for the sake of the families in the middle schools, how bringing everyone back full in person doesn't reduce the density, like how you feel comfortable with the density that's going to be in place.
So that's a good question, Dr. Turner. So basically, what I mentioned was at a given time when we inspected the school, we assembled or ensured that the desks are at the space where they are easily socially distanced from each other. The students are, right? So average 4 to 4.5 feet away from each other. So this was in preparation for the entire class, 100% coming back. If a class is 17 kids or 18 kids, are the desk distance in that minimum of 3 feet or above. The above the better, the greater the better. So when we consider that, and again, we didn't know at that time how many parents will be sending their kids to the school and so on and so forth. So it took me at least, and this was the first time myself going into the AMSO middle school. And when we looked at it with the data from the school providing us that at a given time, the density would be 70 to 80%, which is a good measure. So we're never going to see 100% at any given class, which gives us the leverage of increasing the distance among the students. That was one point. As I said, one of the strategy, looking at the density, because they're not going to change the class. And if the classes are larger, we may have to think about splitting, or we may have to, again, I don't make that decision. The school they know their classes structure better. What I observed was in a situation where we have all students coming back in person, we would still maintain one of the mitigating factor, which is the socially distance during the class. I hope that helps. So if you average it out at a given time, if you have 70 to 80%, we have more leverage to spread apart, and that would at least increase the distance and the risk of transmission among the students.
Are there other questions from our board members?
I did have a quick question. Jenny and I are going to tag team. I just had a quick question about asymptomatic spread. So young people are more likely to be asymptomatic from what I understand, and I'm not a health expert at all. So without any kind of surveillance testing in the schools, obviously in colleges, there are some campuses that do surveillance testing and they're picking up cases that no symptoms at all. But in the Amity district, we don't have that kind of resource available to us. It doesn't even look like it's on the immediate horizon for us to be able to do that. But without surveillance testing for asymptomatic spread, we don't have data that says there's no asymptomatic spread going on, correct? And so the community should understand that even though we're not seeing evidence of spread in the school, we're also not testing for asymptomatic positives, right?
Right. So with asymptomatic carrier, it becomes a question on how good are we doing in terms of taking history. As a clinician, you rely heavily on the information being provided to you. Hence the reason, we're not in a sports team where we don't, belong to any sort of a group of clinicians or, any type of occupation where they require routine testing. So we have to rely on the information and rely on our parents to screen their children. The most important factor is, have you come across with somebody who has been tested positive, a confirmed COVID-19 case? That's the single most definition of coming in and saying, okay, well, this person could be a carrier. He or she may not be exhibiting symptom, but so that piece of information has to be relayed to school, and again, it's an honor system. I don't see that our community would hide that type of information. At least I don't personally believe that that would be, if you come across with some, and we have seen parents informing us or reaching out to us, that, hey, I was seeing my family member and one of them turned out to be positive, and what should I be doing? And so we have to rely on that source of information. Absolutely is necessary to be forthcoming and to let us know so we can take immediate steps. Because if you came in close contact with somebody who turned out to be positive, whether you have symptoms or not at this time, you should quarantine, right? So, and testing, by the way, the rapid antigen testing is not very accurate. It's good only in certain situations where folks have already become symptomatic, right? It's only 50 to 60% accurate. So even if we implement, say, for example, in future, we would like to implement testing, we would still have to rely on the history portion that have you come across or do you know who became symptomatic, in family or close circle, and then turn out to be positive. But that's sort of the, knowledge that you need before, you think that you have eliminated that. Yeah, so asymptomatic carrier will happen unless if everybody, take precautions and try to understand the gravity of the situation.
Thank you.
Dr. Turner, I know you had your hand up before, so.
I did. It was just a question to help the board understand what we might be able to do to better support the school. You mentioned gaps in mitigation that might need strengthening. Are there things that we need to assess the resources we're applying? Or just what are these gaps? Is there a way we can help?
Is it directed towards me or this?
Yeah, I'm sorry.
Well, I just said if there are gaps, if we do identify, at the moment, I don't see any significant gap that must be, filled. What I said was when we have more students coming in, we kind of keep our eyes and ears open, be vigilant about it. And if we find any gap in our mitigation strategies, just to give an example, maybe we're running low in our masks. I know that's not the case, Dr. Byers. I spoke to Tom and everybody. We have enough masks to give to students if they forget at home or they drop it. So I was just saying that if there's anything that we can find, say, for example, that, this time the heating system is not working. I'm just giving an example, right? We need to immediately tackle that and not wait until things go out of control. We always want to be in a mindset of improving. We cannot be complacent that, all these strategies that we have put in place are 100%. And it's just not a good way of thinking as a leader. You constantly find areas where things can improve. It's like continuous quality improvement type of thing. In our hospital, we do that. So even in school, if a teacher think that they need a plexiglass, for example, because they may come in close contact, with less than 6 feet, then we should be able to provide that to make her or make him more safer, in their learning environment. So by that I meant was we need to ensure that we have a good open dialogue between the staff, the teachers, the principal, as well as, in my opinion, I think I have already communicated to the principal that we need a little bit more supervision during the entrance, starting and the end of the school. So, just to direct the traffic. So we don't have any child. And once we make that as a habit among students, then we won't find any issue. Obviously, it's a new learned behavior for those students who hadn't had the opportunity to come to school in person and now coming. We need to kind of look at it and retrain them, so to speak. So those factors need to look at on a daily basis, constantly, and if there's any gap, educational gap, data gap, so we will provide that type or any type of equipment that they need.
Okay, great.
I think the other thing too, just like when we invited the health districts to come back in the end of September, once we had the students in hybrid, to take a look at what things look like and to offer suggestions for improvement and how we could tweak and make things better. during a week when we have our students back for our full in-person, they most certainly would be invited back again to come and take a look and see what it looks like, to offer us information, advice, and how we can make those improvements. We just haven't been able to do that because we haven't had that opportunity until now to have our students back, so that we could see what we can do to continuously improve our system and our structures and mitigation strategies.
I was planning that already, Dr. Byers. So looking at my schedule for
That's perfect. Other questions? Mr. Davis.
Just in the way of some guidance for our parents as far as reporting goes and testing for their children, at what point, let's say a child wakes up, maybe he's not feeling well, at what point should the parent inform the school that the child is not feeling well, or at what point should they take the child to be tested?
So I can tell you from what Miss Luth, our director of nursing, but all of our school nurses are saying is, if your child is not feeling well, don't send them to school. Call us, let us know. And I can see in their notes that they provide, they always tell the parents to go get the student tested. We also see in the notes that sometimes parents will say, I don't want to, and then they will actually say, then you should probably stay out until this date, and they give them kind of like a quarantine date of how long the student should be out. Sometimes the parents just say, I'm just going to keep my student out. Most of the parents do say that they're going to go get the student tested, and then our school nurses follow up if they don't hear from those parents about what the testing results are. In terms of like the window of time for testing, I'll defer to our doctors as to what's most appropriate when a student gets sick. And I know Dr. Germain talks to Ms. Luth on a frequent basis about questions like this. So maybe as a pediatrician, he can weigh in on this.
Yeah, so, the more testing, the better, especially in our symptomatic patients. That's the way that we're going to protect our fellow students and staff. So I would say that the nurses are directing ill patients back to their pediatricians, back to their primary care doctors to promote testing. Another gap that I think has been happening, just tagging onto what Dr. Muhammad was saying, is that at this point of the pandemic, we're all getting a little lax, I think, with some of the measures that we've been taking. So it requires a pep talk to parents and to students that we're giving in our office pretty frequently. And I know the nurses are following up on. So, the first time a child gets sick and they get tested, they're negative. The second time they get sick, they get tested, they're negative. The third time they get sick, the parent gets a little frustrated. So we just have to keep reinforcing that testing, especially for the symptomatic patient, is critical. And at the time of symptoms is the time to test. So there's no benefit in waiting for the symptoms to evolve. The symptomatic period is a high viral period and a good time to test.
Thank you, Dr. Germain. I just want to piggyback what he said. Basically, right, when symptoms are there, and if the parents have determined that in unusual circumstances, they may have come in contact with some unknown member who could potentially be carrying the virus. So the testing, what he's mentioning is about the coronavirus testing. The child can get sick from other illnesses also. So I'm in a favor of, when your child is sick, it's always better to keep them home and get them better before they come to school. But if you have a suspicion of having been exposed to somebody who could be a potential COVID-19, diagnosis, then obviously bring your child to the nearby place where they can get tested for coronavirus. The timing is also critical. Yes, symptoms, they have to be symptomatic to get tested. I never say, go get it tested when they're asymptomatic. Usually within 5 days after the exposure, on average, they start experiencing symptoms. And that's been a sort of a clinically reported. So if during that time you suspect that they may have come in close contact, certainly they do it. But the rule of thumb should be, any child who has any type of symptoms should remain off of school for at least 24 hours before they get better and go back to the school, right, Dr. Germain? I mean, would you say that this is a good time frame when it's not a viral illness or something other serious?
Yeah, and as you know, it's so hard to tell what's coronavirus and what's rhinovirus, right? You can't. So symptoms may be mild and maybe COVID-19 and putting grandma at risk, and symptoms may be severe. And in kids, we know it's commonly pretty mild. So I think there's got to be a low threshold for symptomatic kids to stay home and to get tested. And I would direct those students back to their pediatrician for that advice.
Ms. Cardozo, I see you there.
Here we go. Okay, I think all this information is so helpful to the public, but I'm just wondering, do they actually know these guidelines in terms of when to report, when to quarantine, when to test? I was sort of thinking about frequently asked questions by way of communication. You know, people are. When they need to know it, they want to be able to access it, and probably not everyone is really comfortable calling and identifying themselves. So I'm just wondering if we had additional community communication regarding all of these things that we're discussing, if that might be helpful to people.
So I believe that at actually Dr. Mohammed's recommendation and with his input, we had sent out information just even initially around like PCR testing versus the rapid antigen testing. And when we have put those letters out to the community, Mr. DeRosa has a section of our website where we're posting all of that information. So it's always available there as well. So if somebody forgets what we said, like the travel advisory, for example, if somebody forgot what we're supposed to do in the travel advisory, there is a place on our website where all of that information continues to be posted so they can go back there and remember that. I think to your point though, Ms. Cardoza, sometimes if we just keep sending out information, it's a delicate balance between sending out information again and then just inundating people with yet another Dear Amity Community Swift K-12 message that they just choose to not open because they get one a day. So, but I think that, you know, in terms of providing some guidance for when testing can happen, we can absolutely look at that again, because if you don't remember seeing that message, then chances are our families don't remember seeing that message as well.
That's a very good point on FAQs. I think that I will look into it also and trying to, you know, some of the questions that we've received before the school will resume would certainly incorporate some of that too. Obviously with new information that may change going forward, but I'll definitely be able to work with the school's IT department and post most up-to-date suggestions and advisement. That's a good feedback.
Thank you very kindly.
Other questions?
Okay, Dr. Byers, I don't see any on my screen. I don't see the whole forum here, but do you see anyone else raising their hand?
I do not.
Okay. Okay, great. Well, thank you, everyone. Again, thank you so much to the board for joining us in this short time frame of notice. Thank you so much for our doctors and our health professionals for joining us and keeping us abreast of everything going on and answering our questions to the community, which is so important to have this communication. Happy holidays, everyone. If we don't see you before then, stay safe. And at this point, we will entertain a motion to adjourn. Ms. Cardozo, do we have a second?
I'll second it, Mr. Belfanti.
Okay, Ms. Carlson, thank you. All those in favor of adjournment, can you please raise your hand? Okay, that motion passes. Thank you, everyone. Good night.
Thank you, everyone. Have a good evening.